Welcome everyone to the Brown University School of Public Health Open House for Master's Programs. My name is Matt Wallace and I'm the Assistant Director of Student Recruitment and Marketing. And I am joined here by my friends and colleagues and faculty and current students talking about finals like current students do, which is great. And we're all so thrilled that you're able to be here with us today. It's been a tough year, to put it mildly. And it's just so nice to see this great turnout. It's so encouraging to see so many prospective students that are interested in public health. So thank you for being here and welcome. So just in a little bit here, I'm going to be sharing my screen and having a little presentation. And then after that, we're going to have a faculty panel. And then after that, we'll have a student panel. So it's going to be an action-packed open house. So hope you enjoy it. All right, so without further ado, let me share my screen here. Oh, one more thing before I share my screen. So if you have any questions throughout the presentation, please feel free to ask them in the little chat box, and staff, students, faculty are more than happy to answer them throughout the presentation, so you don't have to wait till the end. All right, can everybody hear me and see my screen okay? A little thumbs up, awesome. So we are going to be talking about the School of Public Health, about Brown University as a whole, the quirky little city of Providence, our Office of Diversity and Inclusion, our master's programs, how to apply, and then of course, how to connect with us. So the School of Public Health. So we are thrilled to have brand new Dean Ashish K. Jha with us. He is a quadruple threat, physician, educator, health policy researcher, public health advocate. You've probably seen him on CNN, MSNBC, Good Morning America. He actually just did an interview with Dr. Fauci here at Brown. Raise your hands, anybody that saw that interview with him? All right, a few of you, yeah, or a virtual thumbs up, however you guys want to communicate is cool. So if not, no worries. What I can do is I'll email everybody that attended today. Afterwards, I'll give you the YouTube link for that. So we're thrilled to have him on board. He's somebody that cares deeply about diversity initiatives. Before he even started, he started the Health Equity Scholars Program here, and I'll talk to a little bit more about that later on. So we're over the moon to have Dean Jha here with us. So the school, our mission is to improve population health by advancing science and training tomorrow's leaders. You are tomorrow's leaders. We need public health professionals more than we ever have in the past. So we're really happy that you're here today. Our values, it's no coincidence. Diversity and inclusion is first on that list. It's paramount to everything we do. We also care about collaboration, innovation, community focus, and doing everything with excellence. And our vision is to impact urgent health challenges and improve health equity. And as you know, there's several urgent health challenges happening and have been happening: anti-Black racism, climate change, COVID, just to name a few. So by the numbers, so in 2019, US News and World Report did a ranking on the top schools of public health, and we are in the top 10%, which is great. What's probably even more impressive is that we're in top 10 in NIH funding. For a small school, that means a lot, right? So that means that there's more funding for research. And speaking of research, we have 13 world-renowned research centers that are doing really innovative things. I'll show you them right now. So from our very first research center that we had, the Center for Alcohol and Addiction Studies, to our newest one, the Mindfulness Center, there's really something for everyone. There's our beautiful building right there. I think the best thing to take away from this slide is that 2-to-1 student to faculty ratio. That's really what you get here at Brown, is that personalized approach, that mentorship that you need to be successful academically, professionally, and personally, really. And our faculty are not only at the top of their fields, but they love working with students. So what defines us? Learn public health by doing public health. That is our mantra, that is our ethos, that is what we stand for. So that's part of our culture. So what does that mean? So you're going to learn the theory part of things for sure, but we really want you to apply that theory. We want you to make a public health impact. We want you to be able to move freely from the classrooms to the research centers and into your community to really make a difference while you're a student here. And we are the perfect collaboratory. So Rhode Island is actually a perfect place to practice public health, and I'll tell you why. So it's no secret why, that it's tiny. There's only 1 million people in Rhode Island. There's only 1,000 square miles. There's only one school of public health. There's only one medical school. There's only one department of health, which is actually great because then you can make an impact on the state level. We have a lot of connections with the Rhode Island Department of Health. As you see there on your screen, Nicole Alexander Scott, who is the director of the Rhode Island Department of Health, is actually an alumna of ours, of our MPH program. And she also teaches for our medical school. So we have a lot of connections. It's easier in a smaller state, in a smaller city. So there's less red tape, less bureaucracy. So you can actually test out your public health initiatives and see what works and see what doesn't. You can collaborate with students from RISD or physicians from Alpert Medical School, policymakers, environmentalists, nonprofits. So it's an ideal place to practice public health. So part of it's getting in, right? But once you're a student here, you should take advantage of the resources that we have. We have so many awesome resources, from the Writing Center to the Career Lab for Life After Brown, the LGBTQ Center. We are the first college to have undocumented first-generation college and low-income student center too. So that's awesome. So Brown has been here for quite some time. We're the 7th oldest college in the United States. So we have a rich history. We also have a rich history of being progressive. We're the first American college to welcome students from all religious backgrounds. Here's a little snapshot of Brown as a whole. So over 1,800 international students, 43% identify as students of color, 57 Rhodes Scholars, 11% are first generation. We're in the Ivy League. Providence. So I really didn't know what to expect from Providence. I'm still relatively new here. I've only been living here for about a year or so, and I had no idea what to expect, but it's an awesome, awesome city. You see the walk score there, 88. That's an excellent walk score. You don't need a car to live here. Also with your Brown ID, you get free public transportation, so you certainly don't need a car. But usually when you see a walk score that's high like that, it means that cost of living is also high, which isn't the case here in Providence. And it's just a fun place to be. It's a very inclusive environment. There's an awesome arts community. I mean, we have RISD here. So the RISD Museum of Art, the Providence Performing Arts Center. There's about just under 400 miles of coastline, all 4 seasons. I know some people aren't thrilled with the winters here, but the autumns are beautiful, and that's what counts. And there's just so much to do, and it's such an inclusive environment. Diversity and inclusion. So we have our own Office of Diversity and Inclusion within the School of Public Health. So here's our leadership, Caroline Kuo and Jamie Potter Rutledge. And I mentioned the Health Equity Scholars Program before. And so essentially what the Health Equity Scholars Program does is it provides select, highly qualified students from historically underrepresented groups with a full scholarship for the MPH program. Enhanced mentorship, and then the internships that you take in the MPH program will be focused on addressing the impact of racism and other social determinants of health. So we're really proud of this program. Also, news, Brown is the first non-HBCU invited to join the National HBCU Library Alliance. So that just happened recently, which is great. We have tons of different programs and initiatives in this in the Office of Diversity and Inclusion. I just put 2 of them on here. The Graduate Students of Color Affinity Group kind of provides a safe space for students to talk about diversity and inclusion and issues around that. OSTEM, which is really for the LGBTQ community who's interested in STEM fields to be successful, professionally, academically, and personally. And there's so many more. And we want to let all flowers bloom. Like if you have an idea for a program or an initiative, we want to hear it and we want to get it started. Master's programs. So biggest programs, the MPH. So Brown is all about choice, right? So here you're going to get a highly customized, highly personalized experience. We realize that not all students are the same. And so we want to, create an academic experience that's right for you. So essentially you'll take 5 required courses. That's like the foundations, right? So like biostatistics, epidemiology, and then you'll take 5 courses within your concentration. You can see the 7 concentrations right on there: epidemiology, maternal and child health, global health, health behavior, health services, mindfulness, and generalist, which Annie Jelsovic loves to call the specificist. So I steal that from her, and she'll probably talk a little bit more about that a little later on. And then of course you'll have your internship and your thesis as well. So it's a very well-rounded program. Then we have our master's in biostatistics. So biostatistics is all about using statistics to solve problems in public health and clinical medicine and biological sciences. And the cool thing about this program is it's really meant for people of all different levels of expertise. If you want to become a professional statistician or data analyst in the industry, in government or academia, if you want to pursue your PhD eventually, it's a good program for you. Or if you're already an established researcher looking for advanced training in biostatistics, it's a really good program. So it's awesome. Biostatistics is also kind of famous for its HIV and AIDS research too. Clinical and translational research. So this program is kind of a little bit more of like a niche program. It's mostly for MDs, physicians, doctors that are looking to kind of expand their operations and bring in some of that knowledge into the clinical arena. Tuition, so it's by course here. The cool thing here is that your application actually doubles as a scholarship application. So you don't have to do any additional paperwork, and the majority of students receive a scholarship from the Brown University School of Public Health. Career outcomes, so pretty good numbers there, 93% and 100%. There's so many different things that you can do, which is nice. So you can work in healthcare, you can work as a consultant, you can work in academia, you can work for a nonprofit, you can work for the government. So there's a lot of different, paths that you can choose. And we have a great career services team led by Sean Kelly. There's a database of public health jobs, internships, fellowships that are updated weekly. You get personalized career advising from Sean. There's nationwide internships and job opportunities in Brown's Handshake portal. Careers in the Common Good, that's a really rad thing. That's a program for students interested in like nonprofit, social enterprise, or public service careers. Admissions. So everything goes through SOFAs or SOFAs Express, depending on the program that you're interested in. And deadlines are coming up pretty quickly, actually. The priority deadline for the MPH program is February 1st, and then the deadline for the biostatistics program is also February 1st. So what do you need? So yay, the GRE is not required this year. I'm curious, how many people are planning on applying to start in the fall of 2021? Raise your hands or, okay, all right, very cool, very cool. So yeah, the GRE is not required. So that's nice. You will need your official transcripts. Personal statement, that's really how you're going to differentiate yourself from the other applicants. And really, and I've sat through on some of these admissions meetings, the cool thing is like, it's not about if you're good enough to come to Brown at all. It's whether or not we have the resources, we have the faculty, we have the connections to fulfill our promise to you. So whatever your dream is, make it clear in your personal statement. And the way the admissions committees look at it is they say, hey, do we have the faculty to support this student? Do we have the connections? Do we have the resources to make sure that they're successful? So I think that's really cool. You'll need your resume. International students will need IELTS or TOEFL, and then reference letters or letters of recommendation. So hopefully 2 out of those 3 will be academic in nature. You might recognize a few of these students from our student panel today. So our school is only as good as its students, honestly, and we have just the best students ever. I am biased about that, but they're so welcoming and so knowledgeable, and really love helping prospective students because they've been in your shoes. So they know how it is and how stressful it can be. So definitely feel free to reach out to any of our students at any time, and they're here to help. And then stay in touch with us, friend us on Facebook, follow us on Twitter, subscribe to our monthly newsletter, and just stay connected. So that is the general admissions email, the sph-admissions@brown.edu. So I am going to go ahead and stop sharing the screen. I hope you all enjoyed that presentation. And the next step will be, I think we can start with our faculty panel. So what I'm going to do is I am going to, well, let's see if we have a question here. I see a chat here. Are there optional GRE requirements due to COVID? Are GREs typically required? So in the past, yeah, we required the GRE in the past. This was the first year that we are not requiring it. And it's for several reasons, honestly. So one of the reasons, yeah, it's difficult during COVID, to get the test and everything. And another is, the test might be inherently biased, to be quite frank with you, women against underrepresented minorities. So it's something that we definitely are taking a real look at to see if we're going to continue it in the future. So stay tuned, and we'll let you know if we continue to require the GRE in the future. But currently for the 2020-2021 application cycle, we are not requiring it. So great question. So what I'm going to do is I'm going to introduce each faculty member by name. And then if you can just kind of introduce yourself, tell me what program you're in, and then maybe a little interesting factoid about yourself. I think that would be awesome. So I know that Professor Brewer is going to be joining us around 4. So let's start with Professor Chrysanthropoulou. If you can introduce yourself, please.
I guess I have the hardest last name. I'm Stavroula Chrysanthropoulou. Nice seeing you all here. I'm an assistant professor in the Department of Biostatistics and director of the master's program in biostatistics. It's my first time I joined this open house. I'm very excited. Thank you, Matt, for organizing that. I'll be happy to answer any questions regarding our program. Of course, you can find a lot of interesting information on our website. And if you still have any questions after these sessions, please feel free to email me. And so, yes, just a very brief introduction, Matt. And you mentioned a fun fact. I should mention something fun about my life. So you can tell from my funny accent and my weird name that I'm from another country. I'm originally from Greece. And I've been in the United States for a couple of years because I got my PhD from Brown University. And I have a daughter. I got married like 3 years ago, and my daughter is now 1 year and a half. And my husband, who's an American, he told me that my daughter speaks English with a Greek accent.
That is awesome. I love that. Okay, cool. Thank you so much. So we will move on to Professor Crawford.
Hi, everyone. Thanks so much for having me. I'm Lauren Crawford. I'm an assistant professor in biostatistics with Stavroula. I do a lot of statistical genetics and cancer genomics type research. So I'm actually really tied with the School of Art Sciences up the hill. So if anyone has questions about a lot of interdisciplinary research or things like that, please feel free to reach out to me. A fun fact about myself, I'm actually in California right now. We flew west for the winter. I'm originally from California. Yeah, thank you, Sarah. Yeah, I took that off. COVID is fun because you could be wherever you want to be. I'm a really big sports fan, so a lot of people like to chat with me about basketball and things like that. I'm a huge Lakers fan, so around this time of year and a lot of the NCAA tournament, people like to hang out and watch games. So.
Awesome, thank you. It's a good time to be a Lakers fan right now.
Yeah, the best.
Thank you so much. Okay, let's go ahead and how about Professor Yelsovic? Annie, are you here?
Yep. I am there. I just had to get my mute and unmute working. Hi, everybody. So my name is Annie Yelsovic. I'm the director of the Masters of Public Health program. And I'm an epidemiologist. I worked at the Rhode Island Department of Health for about 10 years before there's a very intertwined relationship. So I was working in both places for a long time and then fully now at Brown. And I guess a fun fact about me, I'm the one with the hardest last name, but Stravula could, and I could battle that one out. But my last name comes from Norway. It's actually a town in Norway that my great grandfather was from, and my grandmother moved from Alta, which is in the Arctic Circle, south to Tromsø, which is still in the Arctic Circle. So that's our family. As we sort of, I got the farthest south of any of us.
I love that. Thank you so much for sharing. Okay, and last but certainly not least, Professor Wallach.
Hi, I'm Anya Rader-Wallach. I'm a professor of the practice in the Department of Health Services Policy and Practice. I am relatively new to the School of Public Health. I've been here about 4 years. And all of my career prior to coming here was in either in state government or consulting around state government. Probably most relevant for you all is that I was the Medicaid director, I was the Health Insurance Exchange director, and I was acting secretary of Health and Human Services for the state of Rhode Island. So I am now, as I said, a professor of the practice. I'm also associate director of the Center for Evidence Synthesis in Health, and a couple of the faculty in that center are kind of core to the teaching of evidence-based medicine and other kind of related subjects in the MPH curriculum. And I'm now also the associate director of the MPH program for the Applied Public Health Experience. So that's my job is now to try to improve how MPH students connect with applied experiences out in the community. And I think I was chosen for that in part because my experience is more out in the community than in the school. And I have a lot of connections within Rhode Island. So look forward to putting that into practice. And to the extent that I do my own research within the School of Public Health, it's all around state health policy, Medicaid, healthcare costs in states, things like that. Fun fact, I had a hard time coming up with this. My fun fact about me is that I've actually gone to massage school and yoga school and never used either one.
I love that. Not even in your personal life?
Well, yeah. Never professionally.
Okay. Very good. Thank you so much. What I'd like to do now is I'd like to open things up for questions for our faculty panel. So if any of our guests have any questions, please feel free. You can either type them in the chat box, or if you'd like to ask in person, please make sure to just use the hand raise function and we'll call on you. But any questions that you have for our faculty, yeah, please feel free to ask away. So I see Alexandria has her hand up. Alexandria, do you want to go ahead and ask your question? Oh, hand went down. I think that hand, sometimes when you raise your hand earlier and then you forget to put it down, that might be the situation there. So let's go ahead and call on Yinikewu. I'm sorry if I'm pronouncing that incorrectly, but please, yes.
No problem. So hello everyone, my name is Irnek Acho, you can call me Irnek, and I'm a frontline physician working in semi-ICU unit in Ethiopia, and also I'm a sexual and reproductive health advocate and have been working in various leadership positions, and I'm keen to learn or to advance my education in Masters in Public Health, and I have a couple of questions. So the first one is that of, are there like specific programs regarding advancing the sexual and reproductive health, especially for the low and middle income countries? And the second one is, can we also have like, if we also have like an interest in health policy, strategic planning, or other public health leadership skills, are those courses also incorporated in the MPH program? So maybe the third one is through the SOFAS application, I've seen like it's an optional document of like a writing sample. So what does it mean, like the writing sample part? So these are my three questions, and I'm looking forward for the application. Thank you very much.
I'm thinking Annie might be best equipped to answer those, but I don't know.
All right.
I'm happy to answer because I was raising my hand. I wasn't sure how we were doing the faculty part. So let me start with the one that I heard sort of combining a little bit of I think the first two, which was, is there work around sexual and reproductive health going on? And can you get training in policy and maybe other related aspects? So yes, there's a lot of work going on around sexual and reproductive health, both in Rhode Island. We have a lot of faculty working on sexual and reproductive health, and also internationally, although I don't know about in Ethiopia specifically. But I know, for instance, in the Philippines, there's a lot of work, faculty working and students working with them and doing internships in South Africa, also in Kenya, and in China are the countries that come to the top of my head, but there are probably more. And then we have the concentrations, and I think just to take your question and make it for sort of other students also maybe thinking about it, is how do you choose a concentration? So we have a health policy, health services concentration that's very much about health policy, but you also have a topical interest. So that's one of the things that students sort of balance. You know, should I do health services concentration? And my focus I'm bringing to it is sexual and reproductive health, and that completely works. Sometimes students are like, should I do an epi concentration where I focus on maternal and child health, or should I do a maternal child health concentration where I do a lot of epi methods? That's the conversation we have together in figuring out somebody's academic plan. And when none of that comes together, that's where the specificist that is labeled generalist. So it's our accrediting body calls it a generalist, and that's why that's what it's labeled, but it's really coming up with an independent concentration that is specific to what interests you, that Brown has the resources to help you with. So you could do one on sexual and reproductive health. I could see how we could craft that and pull it together. Or you could say, I'm going to do health services, and I'm going to, within the concentration there, I'm going to really use my electives and the choices I have within that concentration to make sure I'm focusing on sexual and reproductive health.
Thank you very much.
Great questions. We've got a couple questions here in the chat I'd like to bring up. So David Matthew asks, is it a good idea to apply for the program even if one doesn't have post-bac job experience? Does anybody want to field that? You can just dive right in, just unmute yourself and start answering if that's easier. So is it a good idea to apply for the program even if one doesn't have job experience? And I'm guessing this program, is it for the MPH, David, or biostatistics?
For the biostatistics, it's definitely, the answer is yes, absolutely.
Okay, great, thank you.
So Matt, I would first go back and answer the previous question, which I don't think we answered about the writing sample. So the writing sample is optional. I'd say most applicants don't. In my experience, I'm on the admissions committee, but I've only been on it, this is my second year. So in my experience, most applicants don't submit an additional writing sample beyond their personal statement. But many do. And often it's to show us a piece of work that might have gotten published, or something that really demonstrates well that you have good writing ability that's really specific to a career path in public health. So sometimes people submit writing samples that aren't terribly relevant, but if you have done some piece of writing as an undergrad that like shows that you really grabbed onto something and researched it well and wrote about it well, and it's very relevant to what you want to continue to study, I would say it's a great idea to submit that, but by no means necessary. And then in terms of the question about, I think I'll leave that to Annie, the broader question. In terms of work experience, I mean, I'll just say we definitely look at work experience in the admissions committee. We say, this person had a whole lot of work experience, and that can be something you did like as an undergrad in volunteer capacities, or it can be actual jobs you've had either in summers or as a research assistant or post degree stuff that you did. Any of that is relevant. It's not required, but it's relevant. So you can apply without all of that. I'd say the more of that you have, the more we think, oh, not only do they have the interest, but they also have some applied experience that shows that they like working in this field. They understand what it means. And they've got some experience under their belt that suggests that this is a good fit, this is a good career fit for them. And Annie, I don't know if you want to say anything else.
I think that was exactly what I would have said. I think that's a great answer.
Awesome. Thank you both. At this moment, I do want to welcome Professor Brewer. So I don't want to miss this opportunity to put you on the spot, Judson. So if you could just introduce yourself and tell us about, your program or role, and then an interesting little tidbit about yourself.
Sure, I'd be happy to. So it's great to be here. I'm Judd Brewer. I'm the Director of Research and Innovation at the Mindfulness Center at the School of Public Health. I'm an associate professor in the Behavioral and Social Sciences department. I'm also the mindfulness lead for the mindfulness concentration for that track at the School of Public Health. I won't go into, if I talk a lot about my research, you won't get me to shut up. So if you're interested in the research that I do, ranging from basic neuroscience to translational to clinical studies with like digital therapeutics, you can certainly drop me an email and we can find another time to talk. Interesting tidbit about myself. Let's see. Eric Laux, who's the director of the Mindfulness Center at Brown, enticed me to come to Brown, I think it was about 2.5 years ago, by promising to teach me how to surf. And so he's tapped into an addiction of mine, or an addictive tendency. And now, believe it or not, there's actually really good surfing in Rhode Island. And if you get a thick enough wetsuit, you can surf year round, even in the water that isn't quite as warm in the winter. So there's a tidbit about myself. Does that count, Matt?
Oh, 100%. That definitely counts. I love that. Thank you so much for sharing. Okay, great. So we do have several questions here. Let me go into the chat box. Would it be possible for any of you to provide more information regarding BRUNAP? Is anybody familiar with that? Unfortunately, it doesn't look like.
Well, So I don't know if any of the other faculty members are working with BRUNAP right now, but I could just give an overview unless someone else is. So I just put in the chat box the BRUNAP website. So it's for those of you who don't know what I'll spell it out. It's the Brown University AIDS program, and it has both research, not both, it has multiple components. There's research components, there's training components. And so it's an active center of excellence or program of excellence happening at Brown around AIDS research. I don't have a lot of details about it, but that is available in the website that I put up.
Thank you so much, Annie. I appreciate that. We have another question from Osli. So this isn't a question specifically for faculty, just whoever's the best person to answer. For the Health Equity Scholars Program, do students have to be from Tougaloo from undergrad? I thought I saw that on the website, or do they just need to be an underrepresented racial minority with an interest in health equity? That is a great question. So originally, yeah, when we first introduced the Health Equity Scholars Program, it was just for our Tougaloo partnership. But this year we are opening it up to all underrepresented students who are interested in the social determinants of health and health equity. So yes, it's open to all HUGs or URM students this year. So great question. We will move on to Talia's question regarding the Biostatistics Master's Program. I was curious to see how popular the data science electives are, how students in the Masters of Biostatistics program typically take those electives, and also how many people are in the Masters of Biostatistics program.
Yes, thank you for the question. So I just want to mention that our program, our master's program, puts a lot of emphasis on the data science, and some of the core courses, the required courses, are courses from related to data science techniques. And also our Professor Hogan is Deputy Director of the Brown Data Science Initiative. I'm also very happy that Lauren has joined this open house, because Lauren and several other faculty have joined appointments with the Data Science Initiative. So there's a big emphasis on the data science in our program. Lauren, I don't know if you want to add anything.
Yeah, I was gonna say that there are a lot of flexibility, I think, with the classes students can take. So for instance, there are some students that are interested in doing PhD, so they can take some of the more theoretical classes like with myself and others. There are also a lot of overlap of things that people are thinking about up the hill in the Data Science Initiative and Center for Computational Biology and the Carney Institute. So there are a lot of different ways for students to take classes in different areas of the campus if people are interested in it, and it gets approval through Stravula and the chair, but these things are easily worked out. So if you have interest, Brown is flat enough where these things can really happen.
Awesome. Thank you both so much. Molly has a question. Can students participate in the MPH program part-time while maintaining a full-time job?
Yes, so you can do it part-time. You need to finish with it 5 years from starting. So that's sort of if you do it full-time, it's 2 years. So that's sort of the limit, if you figure that out, of part-time. But absolutely, we have students in every cohort who are working full-time and taking classes, and whether they're taking 1 classes or 2 classes, whether they're full-time for a semester and then part-time we work with them to figure out their academic plan.
Awesome, thank you. Hannah asks, I am interested in nutritional epidemiology. Are there courses or opportunities for MPH students to participate in research in this field? nutritional epidemiology.
So there is a course, specifically nutritional epidemiology, taught by Professor Simon Liu. It was taught, it's a fall course. It was just taught this past fall. It's finishing up now. So you could take that course, and then if what you're interested in, I would recommend that you would then concentrate in epidemiology, and that course would clearly be one of the courses you would take, and you would take other methodologic epidemiology courses to support the methods that would go into nutritional epidemiology. And the research, well, it depends, there's a lot of different kinds of research. One of the faculty members that's doing a lot with the community and with nutrition is Dr. Patty Risica, around getting food to into neighborhoods, and that is happening also through the I'm going to blank on the name. Dr. Nunn's is the Center for Health Equity, and they have food on the move.
Yes.
What?
The center formerly known as, and now we don't know.
The center formerly known as, right? Sorry about blanking on the names. But they have the program that, there's many different things going on, but the one that that comes to my mind is something called Food on the Move, which is a sort of food truck of groceries and healthy groceries that moves around the city to spots that would otherwise be food deserts. And one of the reasons my kids both went to one of our local elementary schools that is in one of the areas that's considered to be a food desert. And when I used to pick them up from their after school programs, one day a week, there was a food truck there and we could buy apples and whatever. And it was sort of in the place where when you picked them up, there had always been ice cream trucks waiting. And this sort of food truck came in, and now there was also like a place where we could be like, let's go buy an apple, or do you want a banana as your after school snack? So it was a great thing. So I have a personal experience with that one. And they're doing research about getting nutritional food into those food deserts.
Excellent. I love that. We need more healthy choices out there. This question's from Devon. How has your style of mentorship evolved since COVID?
Well, just to give Annie a break, I'll say I've been mentoring students through this, and obviously it has to happen by Zoom instead of people coming and knocking on my door in my office. But it's been pretty smooth, and in some ways a little more. I feel like I'm a little more attentive because we make an appointment, and even though I have to see the person on the screen. We haven't really skipped a beat in terms of students coming to me, making appointments. You probably have to be, if you're shy, you need to be a little more aggressive about reaching out and asking for a specific appointment, because you can't just drop by my office. But I think most faculty are very open to making appointments with students who they're mentoring, and so it's going pretty well.
And I can just second that. It feels, besides the Zoom interactions, the mentorship piece has largely stayed the same for me as well. One thing that I've instituted with my lab is just to have some time for all of us to spend some time together, because we aren't running into each other, in the halls or in the lab or whatnot. And that's kind of been a necessity to, balancing Zoom fatigue from being able to connect. But overall, I totally agree that the mentorship piece hasn't really skipped a beat.
I have a lab actually with about like 6 PhD students and 2 master students and a few undergrads. What we've done as a similar suggestion is we've now created like these almost like virtual hangout spots. So we'll have lab meetings every week where we'll talk about work, but we also have kind of like coffee hangout hours where if you're just happen to be free at that time for like an hour, people could just stop by and chat. I've also recently opened it up to other groups. So we've recognized that there are a lot of new students that are coming into different programs. They may not have a sense of community. So if you happen to meet someone in a class or something, those are now open to people to just stop by if they want and get to know what we're doing and maybe share their interests, even if not even directly aligned. So.
The same in the master's program. Each student, each new student has an academic advisor, and even in the first semester of their master's program, the academic advisor meets with his or her advisees on a regular basis, and this hasn't changed after the pandemic. Unfortunately, everything is by Zoom, but we continue working with them, both the academic advisors and the thesis supervisors, and pay attention to any problems, especially due to the impact of the pandemic on our lives. So yes, it's harder now with the pandemic, but we continue meeting with our students on a regular basis and make sure that everything goes smoothly in the semester.
Awesome. Thank you guys so much. Alexandra asks, what percentage of our graduate student body are adult learners?
In the master's program, from what I have observed, it's a very small percentage, but I just want to emphasize that everybody is welcome to join our master's program. They shouldn't feel intimidated. We don't have any, we don't make any discriminations based on, not even on age, so.
So it's similar for the MPH program. We definitely always have adult learners. And I guess to be clear, so I'm sort of defining adult learners as someone who's left academia, worked for a while, and is coming back into academia. If you're defining it differently, you can let me know. But we always have students that have done that, and for various spans of time. Some students have been not in academia for a decade or more, and then some students have had less time between academic endeavors. But it works for everybody. And in some cases, the virtual may be working a little better for folks who are adult learners, who are sort of used to organizing their own spaces and styles. That's a completely anecdotal thing that I've been seeing, I think, but that's just to put that out there.
Awesome, thank you. Tanawin asks, I'm interested in systematic review and meta-analysis. I would like to ask if an MPH student can get substantial involvement on specific centers like the Center of Evidence Synthesis in Health.
So I'll take that one because I'm the Associate Director of the Center for Evidence Synthesis in Health, otherwise known as CESH. And we always have students. We usually have students at all three levels. So we have normally we have at least one PhD student, at least one master's student, and often we have a undergrad student as well, working on our systematic reviews, kind of being worker bees at least. So if you have any familiarity with a systematic review, what we do is we meet, we're an evidence-based practice center for the federal government. So we conduct, at any given point in time, we're usually doing about 4 simultaneous systematic reviews for the federal government. And we need a lot of labor to do that. And that involves using software that we've developed within our center to screen abstracts, extract data, and then the more advanced students who have more quantitative skills get into analysis of that data and doing meta-analyses, essentially. So depending on your skill level, yes, you can absolutely get involved. We're always looking for students who are interested, who might have some experience in that. And it's interesting stuff because you get to see the steps. If you stay with us for a couple of years, you get to kind of progress. Even if you don't have those skills in the quantitative end of things, you can kind of progress and grow into doing more of that. And you get to see a lot of different subjects. So if you're kind of into like seeing the methods, but seeing it applied to different subject areas in different ways, it's great experience. Because as I said, we're doing usually 4 or 5 at a given time. And they usually last at most 18 months. They can be as short as like 9 months. So you get a pretty rapid training from start to finish in how to do a systematic review and meta-analysis. And then probably just as importantly, in how do you present that to the federal government and the public? You know, how do you summarize the research, which is really important if you wanted to continue to do that and publish your work in the future.
Thank you, Anya. Christina asks, she's currently an RN interested in the application aspect of healthcare. What can you say about career opportunities post MPH that are not in research?
So I could take that one. The MPH is a professional degree, so there's actually equally open non-research career paths as there are research career paths. And so we have students working, we do have them working in hospitals. We have, and some of them in hospitals are working on research in the hospitals, but also they're working in other aspects of the system. We have students working at departments of health. Lots go into NGO work, government work at various, whether it's cities, state level Department of Health, county level Department of Health, or something to do with a city that is public health but isn't labeled public health. So we have students getting out and getting careers in all of those areas.
And I'll just say from my experience in state government, we had a lot of people who had MPHs, whether it was in the Medicaid department which I ran, or the Agency of Human Services, which is kind of the umbrella agency for health, Medicaid, behavioral health, DCYF, which is, Children's Protective Services. There are people in all of those departments in every state I've ever worked in or consulted with who have MPHs, who basically just have a skill set and an analytic mind that they can apply that gives them a leg up over somebody else looking for jobs in that field. And they, some of my favorite people that have ever worked for me, not only had MPHs, but a number of them came from this program.
Very cool. All right, so we have about 6 more minutes for the faculty panel, and then we're going to move things on over to the student panel. So hopefully I'll be able to get all these questions answered. If by any chance you don't get your question answered, no worries. I'm going to email everybody after the open house with everybody's contact information. So definitely feel free to reach out to us. And I apologize in advance if we're not able to get to everybody's questions. But Victoria asks, how many students engage in work/practicum experiences, as well as research assistantships or fellowships? Does this typically take place during the semester or in the summer?
So in the master's program, students can start even from their first semester working on research assistantships or other projects. So yes, there are several opportunities to have practical experience during their 2 years of the program.
And I don't know if I should do it or Anya, but I'll jump in and Anya can fill in if I forget anything. But yeah, you're required in an MPH program to have an applied experience, and it is just sort of that happens either there is some flexibility, but the majority of students do it either during their second semester, so the first spring they're here, or the summer between the 2 years. And if you're doing a global health, if you're a global health concentrator and you want to go to a site to do your applied experience, then that happens in the summer. Some students get internships that happen spread out across the semesters.
Yeah, I was just going to say it's required, but we're very flexible about how you do it.
Cool. Student asks, does the MPH degree program STEM designated? So it is not. Our STEM programs are Masters in Biostatistics, PhD in Biostatistics, and PhD in Epidemiology. Those are our STEM designated programs that we have. Let's see here. Could you talk a little bit more about the process timeline for declaring a concentration for the MPH program? It looks like SOFAS does not have an option to apply to a specific concentration.
Yeah, thanks. So you don't apply into a concentration, you apply to the whole MPH program, and then you have to declare your concentration by mid-January of the first year. And that's to allow you to do some exploring. Again, like I talked about, you might be, I'm interested in epi and maternal child health. How do I make that work? Well, you come here, you meet with the faculty in each of those programs. We've set that up through some lunches to facilitate that. You reach out to them, meet with them. You see what the curricula are for each of those. You look at the courses, you talk to some of the students who are in their second year, you talk to some who are in each of those concentrations to hear about it. And then you make a decision. It is helpful. We start in orientation talking about it because although we don't require you to declare until January, it's really helpful to back up and sort of know where you're headed, narrow it down to one specifically, or maybe between two, but to keep it wide open for a long time makes it hard to do an academic plan. But we don't require you to declare until January, and you are accepted into the MPH program, and you are then able to choose the concentration that works for you.
Thanks, Annie. So I think we have time for 2 more questions for the faculty panel before we move on to the student panel. So this question comes from Lauren, interested in the MPH health behavior concentration, has a predominantly biology or life science background. How might she address her experiences? Would she be at a disadvantage in applying for that concentration?
So you don't have to, it's helpful to tell us what you're interested in because we want to make sure we can meet your interests and needs. But you don't have to apply into the health behavior concentration. And so what we would be looking at in the application more than does this person match up with health behavior is does this person have the background and the skills that we think will help them in an MPH in general. And so if you want to talk about really thinking about you have a biology and life science background, so then address in your essay, what is it about public health? I have these experiences, they're clearly related, biology and life science to public health. What about that makes you want to do the MPH? And if you have any other like volunteer experience or life experience that comes into that, that's helpful too.
Okay, very good. All right, so it's about that time to transition to the student panel. So please, faculty, if you'd like to stick around, that would be awesome. But I understand if you're busy, if you have to leave, that's okay as well. So we are going to move on over. I'm going to put all the students on the spot, just like it did all the faculty panel. So I hope you're ready to answer what makes you your interesting tidbit. Let's go ahead and start with Toby. Toby, would you like to introduce yourself and tell us your program and an interesting fact about yourself, please?
Yeah, hi everyone. My name's Toby. I'm a first-year student in the Biostatistics Master's program. And a little bit about my background. I spent the last 10 years doing math and science education, teaching and tutoring. So for me, this program is kind of a transition to a new career path. An interesting tidbit about me, I was actually a professional poker player for a couple of years. Right out of undergrad, I decided to, I played a lot of poker in my senior year and decided to just not look for a job and just keep playing poker for a while.
That's awesome. I love that. Thank you for sharing that, Toby. Let's go ahead. How about Noor? Noor, would you like to introduce yourself?
Yes, my name is Nora. I'm a second year in the Masters of Public Health program. I'm doing the generalist track because I wanted to kind of mishmash a bunch of different things to look at how sociocultural, political, and historical factors could influence health. And an interesting fact about me is that I learned how to drive on a manual car.
Not always easy, but then it's all downhill from there. Quite literally sometimes when you're in manual, you have to hit that parking brake.
Yeah.
Thank you very much. Okay, how about Anna? Anna?
Hi everyone, I'm Ana Lucia. I am in the Masters in Biostats program. I also was an undergrad at Brown. I graduated last spring, so I'm pretty familiar with the Providence and kind of Brown community. A fun fact about myself, my parents are getting a new puppy in February. It's going to be a Bernedoodle, and we're going to name it Fauci. And I think this group, more than anyone, is going to appreciate that.
That is so awesome. I love that. Thank you for sharing that. Okay, how about Emmanuel?
Hello, everyone. My name is Emmanuel. I'm a second year MPH student. And like Noor, I'm doing the generalist concentration just to kind of get a broad understanding of public health. And I'm interested in a lot of different methods to study public health. And an interesting fact about me is after college, I biked across the United States.
Yeah, that sounds awesome. Cool. Thank you so much for sharing that. Is Uttam here? I don't know if I see Uttam. Uttam, are you here? All right. All right. So last and certainly not least, Hannah.
Hi, everyone. I'm Hannah. I am concurrently in my first year of my MPH program and my senior year of college because I'm doing the 5-year combined undergrad MPH program through Brown. I'm currently back home in California right now, and my fun fact is that I used to manage a 3 ropes courses over summer for my summer job.
Awesome. That's terrifying. Thank you so much. I appreciate you sharing that. All right. So I'd like to get you all started off with a question, and then please, all of our guests, if you have any questions, go ahead and type them in the chat box. But I'd like to ask you, how would you describe the culture here at the Brown University School of Public Health?
I can start with that one. So something that drew me to Brown in general, but then also to the School of Public Health, is how collaborative the culture is. I grew up in going to school in a very welcoming and collaborative culture where people want to work together rather than kind of being competitive between each other. And I really found that at Brown, and think that that's a really important factor for a healthy learning environment. And just everyone is really friendly, willing to help out, and that goes for both students and faculty. And so I really enjoy it.
Anybody want to add to that?
Yeah,
All
I
right.
can jump
Okay,
in
cool.
quickly.
Go ahead, Anna.
Yes, I think Hannah and I are a little biased because we spent 4 years or are spending 4 years at Brown and are choosing to spend a couple more. But I hope that's a good sign. I think the tidbit I always like to share when I think about the School of Public Health at Brown is I remember being a freshman at Brown. I was taking Intro to Public Health. I had shopped a bunch of public health courses. I'm not going to lie, like that was 4 years ago. And I kept seeing white men in front of me, you know, at the front of the room. And I was like, oh gosh, you know, this is Brown. It's supposed to be a progressive place. What am I doing here? Where am I? But then I went to the Women's March in the spring or in the winter and like ran into a whole cohort of global health male professors that I knew from like just various kind of mentorship opportunities. And so just saw them there, you know, at a Women's March. And I think it just solidified for me in that moment, like how involved the School of Public Health individuals are beyond, like in the community in Providence, in the lives of people around us, in the lives of, you know, people like globally. I think there's a lot of action in the School of Public Health behind the theory and the kind of classes that we take. And so I really like that part of the culture.
Awesome. Thank you so much. Devon asks, why did you choose Brown? What do you love about your program? And then what would you change about it?
I chose Brown because of the open education, and I was told that I could take classes outside of the School of Public Health. I wasn't 100% sure how I wanted to look at health issues, so that was really attractive to me because I wanted to explore sociology classes as well as history classes, and that really worked out for me because I've kind of put together a generalist track concentration that allows me to explore all those kinds of disciplines and put them together. Because, I mean, public health is an interdisciplinary subject, so having the opportunity to look at it from that perspective was really what attracted me about Brown.
So I chose Brown because it's a small program and it also has, like Matt said during the presentation, really robust research opportunities. So when I decided to come to Brown, I emailed a few professors and they all very enthusiastically responded. And I was able to do research kind of from the beginning of the program. And that seems like pretty unique compared to people I've heard in other bigger MPH programs. So if you're interested in doing being a research assistant or just being involved with TAing or other kind of these kind of like extracurricular opportunities, Brown's a really great place to do that.
I can jump in on maybe what would you change about it to just switch things up. I'm in the biostats program, so this is quite specific to that master's program. I think something I love and also sometimes I might change about the program is it's very application heavy. So a lot of my classes, a lot of my homeworks are looking at how we apply biostatistical methods. I think that's really useful for, you know, what I plan to do next. I also some days do wish there was more theory, more math theory in my classes. I think some of the classes in biostats are pretty application heavy and lack a little bit of theory. So I think if you're coming in with a really strong math background, you're set up to kind of like have your math theory history and jump into some application. That's probably a really good setup as a biostat student.
Staying on that subject of biostatistics, what makes the biostatistics degree program unique? How does it differ from other universities?
So I mean, there are two different ones. There's the master's in biostatistics, and then there's the MPH that now has the biostats epi track. let's see. So I think if you're strictly interested in in methods, then the biostats Masters of Science is going to be for you. But if you're someone who is interested, who maybe comes from a social science background or is interested ultimately in some social science applications, but wants the research skills or the quantitative skills, kind of the study design skills integrated into that social science practice, I think that the MPH Biostats EPI track is going to be perfect. And you have a lot of flexibility within that track to take, you know, like as challenging courses as you want. And I have a bunch of friends in the MPH Biostats EPI track that are in my kind of pure biostatistics classes. So there's a ton of overlap.
Can I just jump in? We are sunsetting the EPI Biostats combined concentration. So just so these students, I'm glad you see the overlap, but these students wouldn't have the option of that. They would have to do that as an independent generalist concentration. Just to clear up some language, sort of if people are looking for that concentration on the website, it's not listed because we have sunset it.
Awesome, thank you. So Faith asks, for the students in the UG MPH program, how did you know it was right for you during your first undergraduate years at Brown, and what were the factors in your decision? Now, are there any students here that participated in the UG MPH program?
I think I might be the only one here right now. But I can speak to that definitely. So pretty soon into college, into my freshman year, I realized I wanted to study public health. I was kind of going back and forth a little between health and human bio and public health, and really realized I liked the social aspects of it as well. And I had the mindset at that point in time that a lot of work that I was interested in doing for public health kind of required a master's level. A master's degree. And so I know now, especially with the global pandemic and everything else, that's not necessarily the case, that a master's degree is required for a lot of public health work. But back 4 years ago, that was kind of my mindset about it. So I knew I wanted to do some sort of master's program. And I was considering both Brown and kind of thinking about applying to other schools as well. But I kind of just fell in love with Brown and realized I would love to stay there more time if I could. And so I think so one thing I had noticed is that different MPH programs do have some kind of different focuses of what a lot of their research is on or what tracks are available. And so I realized that Brown did line up with what I was interested in. I think I left this out earlier, but I'm on the health behavior track, and that's what I'm really interested in studying and pursuing. And so it just really aligned with what I wanted to do with my academic career. And that I just really did like my experience at Brown so far. And I had kind of already connected with some professors to do research. Right now I'm doing an undergraduate thesis, and I will be for my honors, and I'll be doing an additional master's one next year. And so just having some of those connections already really made it an easy transition into doing the 5-year program.
Thanks, Hannah. Paige asks, what are you doing to fulfill the internship requirement for the MPH?
I can talk about my internship that I completed over the summer. I worked with the director for the Center of Mindfulness, Professor Eric Laux. He has put together a mindfulness intervention for young adults, and I helped him collect some qualitative data to kind of understand what aspects about the program students who went through it enjoyed and what areas they felt needed to be improved. And we're working on writing that up into a publication, but right now it's just a manuscript.
For my internship, I'm working with actually Brown Takes Care, which is the kind of public health awareness campaign on campus, and just doing some storytelling projects and helping convey the different experiences students and staff and faculty are having during the pandemic. So getting those stories out to like social media and other kind of web-based platforms.
So I'm in the process of finding my internship right now. I think what I'm currently looking at is working with some nonprofit organizations, likely United Way for Monterey County, which is my hometown, of developing COVID response protocols and working a little around that. And so I wanted to note that since the other two were Brown related, that it doesn't have to be related to Brown or the School of Public Health, and that there are a lot of different organizations that you're able to do work with.
And I'll add on maybe to that to say you can even go abroad. And I did research in Cape Town, South Africa, a couple summers ago, and was there with 2 Brown MPH students doing their internships. One was doing it with Doctors Without Borders, MSF, and the other one I think was, again, working at another nonprofit in the Cape Town area. But there's definitely opportunities if you kind of line up the funding and have that kind of plan ahead vision to do your internships abroad.
Awesome, thank you all. So Wenzu asked, so should we apply to the generalist concentration if they want to focus on epidemiology and biostatistics for the MPH program?
Can I jump in, since that might not be something a student would know? One, you don't have to apply to a specific concentration, but the other is if you're interested in epi-bio, you have three electives. You have 5 core, 5 concentration, and 3 electives. So you could craft something that is epi-bio within the epidemiology concentration by picking your electives in biostatistics, and even within the epi concentration, there's choice, and you could pick some things that are more whichever part of biostatistics is of interest to you, whether it's data science or theory driven. Or you could do a generalist to pull it together.
Awesome, thanks, Annie. Thomas asks, what is one great thing and one not so great thing about being a student and living in Providence?
I can jump in for that. So one great thing is that I think it was mentioned in the presentation, but there's a lot you can walk to from kind of the College Hill area. There's a lot within a really short distance. There's a lot of great food and restaurants and a lot of fun places to go, parks and stuff like that. I'm from California, and so one not great thing was just the winters there. And we do get snow. We do get some really cold days. But I guess that's maybe just the Northeast in general, not just Brown or Providence. But I would say that's kind of the one criticism I have.
I think that the only thing I'd add to that is the beaches. It's really fun to go to the beach in the fall, even in the winter. I've had a good time just peacefully walking along the shore. And the cost of living is fantastic.
I'm driven by food, and like right on College Hill and around College Hill, there's really good food in the area. I think I'm tied right now between a Thai place on Thayer called Hang and Aleppo Sweets, which is a Syrian place that just opened up maybe like a year or 2 ago. So if you're visiting Brown ever, stop there. I think a not so great thing I think I guess for a master's or PhD student, this might feel a little different if you're living quite far from campus. But if you choose to stick around College Hill, it's really easy to stay isolated kind of in the College Hill bubble. And I think there's a lot to love about the greater Providence area. There's also a lot to recognize about the inequality and the disparities that exist in the larger Providence area. So I think, one thing to just be mindful of is like how you engage with the larger Providence community and kind of sometimes what feels like a lack of recognition for what College Hill feels like compared to what larger Providence feels like.
Anybody else want to add anything?
Yeah, I was going to kind of echo what Anna just said about the broader community. And the flip side of that is when you get to Brown, there's so much going on campus with lectures and events that it can be easy to kind of get caught up in the College Hill area, but there's a lot going on in Providence as a whole. And so it's kind of like a two-sided coin.
All right, thank you. How has virtual learning changed the program or student experience? Or has it?
I would say I was surprised for some of my classes how little it really felt like it changed. I took the semester one seminar, which was about 20 people, and it really felt pretty seamless. I know I was actually abroad last spring, so I wasn't here when it was kind of cut in the middle of the semester of that transition. So they've had some time to kind of work out some kinks and like develop it to be more friendly to an online platform. I've also seen there's just kind of a variety of different styles of how to do remote or hybrid classes. So not all of them are all synchronous. I know the intro biostats class was all of the lectures were pre-recorded, and then we would have an asynchronous or a synchronous lab once a week. But just kind of having a lot of mixed media really makes it feel like you don't have Zoom fatigue of being on a live call kind of all day, 5 days a week. And so there's a lot of different ways that professors have worked around making it still engaging.
All right. How does the faculty and student ratio play out? Do the faculty give support to their students?
Yeah, I would say that all of the classes that I've taken so far have been really small, and it's been really easy to connect with professors, and they're really responsive. Like surprisingly responsive. Like I'll send them a message on like a Saturday night and get a response. So, and that was one of the things that drew me towards Brown is I'd heard from other students that professors were really available and like really excited to have you join their research. And so far I've found that to be true as well.
Anyone else want to add to that?
Yeah, just to add to that, when you get to Brown, you'll be put into a small advising group with 4 or 5 other students. And it's a really great way to kind of quickly develop a relationship with a faculty member, even if they're not in your particular concentration or don't necessarily do research in the field you're interested in. They can kind of orient you towards their colleagues to start building more relationships. And that's a really great way to kind of start building connections, because there's so many faculty members in the School of Public Health that do so many different things. It can be kind of overwhelming to go through the websites. The other, a good place to start is the Researchers at Brown website to kind of start reaching out as a prospective student. And like Tobias just said, they're very responsive and enthusiastic about developing relationships with students.
I also think Professor Crawford was sort of alluding to this earlier, but there's a lot of sort of out of house, out of School of Public Health connections you can make. I guess even within the School of Public Health, I'm, a biostat student, but all of my research is in the epidemiology department and center. And then again, you can even kind of step out of the School of Public Health and take your skills to like computer science, to sociology, to engineering even. Those crossovers for research outside of the classroom are definitely available.
Yeah, so I guess that kind of begs the question, what opportunities are available outside the Brown University School of Public Health? What opportunities have you taken advantage of?
I was just gonna
Go ahead, Noor.
Yeah, I was just gonna say I do some volunteer tutoring through Bright, the Brown Refugee Youth Tutoring Enrichment Program. So for 3 hours each week, I tutor a young elementary school student, just volunteer work to try to get involved with the community. It's been really rewarding. There are other ways as well. I do some advocacy work through a local advocacy team associated with the Friends Committee for National Legislation. Yeah, so those are 2 community projects I'm involved in.
Anybody else want to share their experiences outside of Brown?
Mine are largely abroad because of my interest in global health and HIV in sub-Saharan Africa specifically. But so I've done like one summer in Peru working on a maternal health intervention, one summer in Cape Town for a thesis project. But I think, right down the street at the Rhode Island Department of Health, I've interviewed there a few times. They are always looking for, not just because of the pandemic, they're always happy to bring in Brown students for various kind of like part-time school year positions or summer internships, hiring after you graduate. That's a phenomenal connection to have right, down the street. There's like numerous connections with Harvard, with Boston University, kind of the larger Boston area. There's the Center for AIDS Research that hugs, I think, like all of those universities. So, and they have different funding opportunities if you're interested in HIV research, and a lot of mentors also that could take you on. So those are a couple I've been involved in.
Yeah, I interned this past summer with a Brown alumna, actually in my hometown in California. And so that's just another way that there's just such a strong alumni network throughout the states and throughout the entire world of connecting that way too. So I think that there's a lot of great ways to find positions through through that. And like with this particular alumna, it was at a Center for Child and Adolescent Behavioral Health. And we kind of worked together to create an internship because there wasn't really one established. And so just everyone is really willing to help out, and that's great. That extends beyond just Brown in Providence.
All right, well, it's 4:59 here Eastern time. So I want to ask one last question. If each and every one of you can kind of describe Brown or describe your experience at Brown in just one word, with just one word, how would you describe it? So I am going to Go around the horn here. I'll pick on Anna first.
Oh boy. I'll go with something cheesy like growth.
I like that. That's not cheesy. That's excellent. Toby.
I'd say fascinating. Like each time I go to class or go to like one of the many seminars or lectures that you'll get invited to, I'm like, ooh, that sounds like fun. Or I'll read about somebody's research and be like, ooh, that sounds like fun too. Yeah, there's just a lot going on.
Perfect. Hannah.
I'd say community. I think just a lot is focused on working together to solve public health problems and enrich our learning.
Noor.
Interdisciplinary.
Great. And Emmanuel.
I'd say engaging. I think everything that's happening at the School of Public Health feels very urgent and of the moment.
Beautiful. Well, thank you so much for being on the student panel. Thank you to all the faculty that were on the faculty panel, and a huge thanks to everyone, all of our guests who joined us today and asked such amazing questions. I hope you learned a little bit. I hope you enjoyed your time with us. We certainly enjoyed our time with you. And I will definitely be reaching out to everyone who registered so we can keep that connection going. And of course, if we don't get to speak to you, we hope you have a wonderful and safe holiday season. So thank you all, and maybe we can all unmute ourselves and thank each other so we can all hear ourselves at the end. How about it?
Thank you.
Thank you.
Hi, thank you.
Happy holidays. Thank you.
Take care, everyone.